We like to think we've moved past the horrors of slavery. We pat ourselves on the back for abolishing such a barbaric practice. But have we really? What if I told you that a system exists right now in our shiny modern world that mirrors the exploitation and control of slavery? It's not hidden in some far-off land, it's right here, woven into the fabric of our society. It's the healthcare system. Now before you dismiss this as hyperbole, hear me out. Think about it. Millions are trapped in a cycle of debt, their lives dictated by the whims of insurance companies and pharmaceutical giants. Sound familiar? It should. Replace plantation owner with insurance executive and suddenly, the historical parallels become chillingly clear. This isn't about literal chains and shackles, it's about a system that keeps people tethered to exorbitant costs, denying them basic care and dignity. It's about a system that benefits the few at the expense of the many, mirroring the power dynamics of a bygone era we claim to have left behind. We need to stop pretending this is just how things are. It's time to acknowledge the uncomfortable truth. We've created a modern-day version of a very old evil. Let's talk control. In the era of chattel slavery, control was brutally explicit. You were owned, your life no longer your own. Today the chains are less visible, but no less binding. They come in the form of pre-existing conditions, lifetime caps, and networks that dictate which doctor you can see. Imagine being told you can't afford the surgery that could save your life, or being denied coverage for a medication you desperately need. Suddenly, the freedom we celebrate feels awfully hollow. And who are the overseers of this modern plantation? Insurance companies with their profit-driven algorithms and armies of bureaucrats determine who gets care and who gets left behind. Pharmaceutical companies with their monopoly on life-saving drugs hold the power to make or break your bank account and your health with the stroke of a pen. This isn't healthcare, it's a hostage situation. And it's time we start treating it like one. Let's be clear, the healthcare system, as it stands now, is a business. And business is booming. But who's really profiting? Spoiler alert. It's not the patients drowning in medical debt, and it's not the nurses working themselves to the bone for meager wages. We've created a system where keeping people sick is more profitable than keeping them healthy. Pharmaceutical companies rake in billions while patients ration their insulin. Hospitals prioritize expensive procedures over preventative care. It's a perverse incentive structure that would make a tobacco executive blush. Remember those slave owners who got rich off the backs of unpaid labor? They'd recognize this business model immediately. It's all about maximizing profits, even if it means sacrificing human lives at the altar of the almighty dollar. Here's a dirty little secret about the healthcare system. It dehumanizes. It reduces individuals to data points, line items on a spreadsheet. And nowhere is this more apparent than in how we treat marginalized communities. Black women are 3 times more likely to die from pregnancy-related complications than white women. Indigenous communities face staggering rates of preventable diseases. These aren't just statistics. They are human beings denied basic dignity and care because of the color of their skin or the zip code they were born in. This isn't just a healthcare issue, it's a social justice issue. It's about a system that perpetuates the very inequalities it should be working to dismantle. It's about time we started seeing patients as people, not profit margins. So, what do? Throw up our hands and accept this as our fate? I certainly hope not. We've diagnosed the problem, now it's time to find a cure. First, we need to call this what it is. A system rigged against the sick and the poor. We need to acknowledge the uncomfortable historical parallels and understand that access to healthcare is a human right, not a privilege reserved for the wealthy. We need to demand change. We need to hold our elected officials accountable for prioritizing people over profits. We need to support organizations fighting for healthcare justice and amplify the voices of those most impacted by this broken system. It's time to break the chains of this modern-day form of slavery. It's time for a healthcare system that truly cares for all. The prescription is clear. Now it's time to act.